Welcome back to Taking Charge of My Cancer podcast. And I have a great guest with me today, Adrienne Langford. She is an occupational therapist, entrepreneur, and a healthcare innovator whose background is in creative and meaningful informs her acute care practice. Adrienne specializes in patient-centered care interventions that maximize functional outcomes and enhance quality of life. Before entering healthcare, she worked as a professional photographer, a career that shaped her neat eye for detail and deep appreciation for the power of capturing meaningful moments. By uniting compassion clinical care with artistic vision and entrepreneurial drive, Adrienne brings a rare integrative perspective to healthcare innovation, developing solutions that help care team members better support patient and family during some of their most vulnerable moments. As well, she was diagnosed with breast cancer last year and went through neoadjuvant chemotherapy and is recovered from surgery after just a few weeks ago. So, this is a very special podcast just because I think she is the first patient that actually agreed to do this, being this close to just really recovering from surgery. So, Adrienne, really, I appreciate you being here with me today.
Well, thank you for having me. It's nice to kind of get back to a sense of normalcy.
Exactly.
Yeah.
So you and I go back. We were talking a little bit earlier about like maybe 7 years ago that we met at North Florida where I do some PRN and acute care. And I think we just really kind of go along really well because your grandma was from Colombia, where I'm
hmm
from. So that kind of like, oh my God, Colombia. And then we start really chatting. And every time we kind of get to see each other at work, try to practice some Spanish with me. And
And you
that's
correcting my Spanish.
and so that was has been really a great relationship. And then things happen for a reason, and you knew I was in the space of oncology and reach out when you were diagnosed. So happy to be in there helping you out and continue being there for you along the way. So thank you for letting me do that for you.
Oh my gosh, I'm so glad it's you.
Okay, excellent. So, before your diagnosis, how do you think you understood cancer care? And how did that change once you became the patient?
I don't think I had a good understanding at all about cancer care, es- especially breast cancer, because it did not run in my family. I think my mom told me I had a great grandmother and a great aunt, kind of removed, but not in my nuclear family.
Mhm.
So it was definitely a surprise when I was diagnosed, because if anything, I thought maybe lung cancer because I smoked when I was younger. So
Okay.
that was on my radar. It was a complete shock when it was actually breast cancer. Um, yeah, it became a full-time job, really understanding the implications of what a cancer diagnosis is. I didn't realize how many layers, and the more you tug, I would tug at a thread, the more the sweater would just unravel.
Hmm.
And it was just overwhelming. It was like, what type of, oncotype, right? Where's this? What's the size? What's um, the position, it just was a whole new language, and I just didn't understand what that meant for me and for treatment. I never knew what that word neoadjuvant was. I mean, that was new to my vocabulary. So
Hmm.
I didn't know much about cancer care. I treated patients with cancer, and I just knew how to be a compassionate, a clinician,
Hmm.
but I had no idea what they were going through.
So now that you've been a patient, and if you go back to the shoes of treating that cancer patient again as an occupational therapist, what do you think will you do differently? Besides, of course, continue being compassionate.
Uh, um, how would I be an OT?
Mhm. Yeah. With the knowledge you have now versus what you knew about cancer care before.
Oh gosh. Oh,
And I
that's
know that can be a loaded question. So, just think about, the patient that you just saw, again, the cancer patient that you saw in the past that you just did what you know what to do, or you knew what to do at that point. But
Yeah.
what else would you do for that same patient now with the knowledge that you gained through this experience so far?
Oh God. I would try to provide resources if that was what they were needing. I would first try to find them where meet them where they are. Are they in the information gathering stage? I can point them to a ton of resources that I have found that have helped me over these months. So
Mhm.
that's where I could meet them. If it's strategies for regulating their nervous system because, just the stress and the overwhelm of a cancer diagnosis. I found myself going back to my meditation and my deep breathing to that 4 7 8 or 6 7 8 4 7 8 breath to just calm down. So do some deep breathing, with my patients if that's where they're at. Be just a sounding board if they need it to talk and to vent. And okay, that's what we're going to do in therapy right now. What can I help you with? Where are you on your journey and how can I be of the most support as a fellow cancer survivor? So, um, yeah, I think it has increased my compassion, but it's a different knowing now.
Exactly. Yep.
Yeah.
Yeah, so I think that that's what, at least that's what happened to me, right? I treat many cancer patients who used to have cancer and they're in remission in the orthopedic world, right? So I treat them for back pain, shoulder pain, neck pain, and they have
Mhm.
a history of either breast cancer or any other kind of cancer. And
Mhm.
before I knew anything about oncology, I was like, okay, yeah, you have a history of cancer, okay, but now you're in remission. Great,
Mhm.
think of anything else, and I just move on into their shoulder or their back or whatever it was. Knowing
Mhm.
what I know now, how that can actually, a long term, imply some things that I wish I knew then, that I can address, how I can address that now.
Mhm.
It's a different ball game. So definitely the knowledge that you gain through this, and unfortunately you have to do it through your diagnose. But what I say, unfortunately, because nobody like to be diagnosed with cancer, but I have not heard of any patient who has been going through cancer on these 17 years I've been doing this, that every one of you, and I'm not saying that you were not healthy because you were a very healthy human being before all this happened,
Mhm.
but become even more conscious about your health, more conscious about what you eat, how you exercise, how you sleep, how do you do your self-care. So
Mhm.
that really makes a difference. So at the end of the day, even though I'm sure it's overwhelming because I kind of share that with you guys, but I have not been on your shoes to say I exactly feel how you feel because that's never gonna be the place, except if one of these days I end up with a diagnosis. You
God
never
forbid.
know. Yeah, hopefully not, but you never know. But I can only share what I live with every day with every patient and what you guys go through and try to understand what you guys go through.
Mhm.
So, do you think that being an occupational therapist and having some other different background um, help you or overwhelm you through this diagnosis?
Um, it didn't it didn't overwhelm me. I think it it helped me. Um, yeah, it's hard to like separate my OT lens just from like a human being lens, Being an OT, like working in the hospital system, we know too much, right?
Mhm. Yeah, yeah.
And that part was a little scary because it's like, oh my gosh, like
What can
I
go
know
wrong? Yeah.
what can go wrong. I know how the system works, so I think it made me become more of a fierce advocate for myself
Mhm.
and knowing that, you can slip through the cracks or you just go along with, they say this, this, and this, but like I know to challenge that a little bit more, where it's like, no, that, well, what about this? And, can we try this? And so it really became my full-time job
Mhm.
to read all I could. I got a lot of material from you, especially around the fasting, to kind of bring into my arsenal. Like,
Mhm.
okay, all right. And it's my control nature too, where it's like, I'm gonna teach this cancer. I'm
Yeah,
gonna be the best
absolutely.
like cancer patient I can be. So I'm glad that I have the medical background, so I know how to read the research papers. I know which articles to look for,
Mhm.
and yeah, just take it from that lens. So it was a little overwhelming, but I felt supported in that way where I like, okay, I kind of know what to do. This is my turf in a way.
Mhm.
And I think that also I I tried to lean on maybe OT in the beginning because it's like, okay, I know how to be an OT. So when I was working with you, I always felt like I was co-treating a patient, but that patient was me. I was like, oh my gosh, I'm trying to tell Durley her job. I know what
No,
yes, just be the patient.
no, but that's great because guess what? I empower every patient to be your own CEO of your health. So even though more people knows about this cancer diagnosis, beginning with your breast surgeon, that doesn't mean that you have all the rights to ask as many questions as you want, and you have as much right to bother them and send messages if you don't get the answers. Because if
Right.
you know, I don't want to say annoying, but you're just really fighting for your rights, right? And so it's like, well, I hear this, what's going on? You say you're gonna call me, but nobody's calling me. What's happening? I
Hmm.
understand that you guys get busy and I've been trying to be patient, but
Hmm.
if just don't feel bad because if I'm on your shoes, I would do exactly the same thing. I'll be looking at the research and I'll be not questioning by asking the medical oncologist, what about this protocol? What about this? I see in the
Hmm.
papers that this looks better. Do you offer that? What is your thinking
Hmm.
about this?
Hmm.
So you have like all the right to question because it's your body and you're the one at the end of the day who make decisions, right? For what you need to be doing. We are not pushing you to do something you don't want to. We just
Right.
give you what we know of and the pros and the cons, but at the end of the day, is your decision to do whatever you feel is right for you.
Right, right. And I was empowered to do that. Like I was in constant communication with my care team and making sure I had the appointment set, and I lived on my chart. I was getting notifications every day. I mean, really, it's not joking. It just becomes your full-time job,
Yeah.
trying to answer the calls and schedule the appointments. And it's like your life now is given over to the care team. And it's like, okay, we have this date available. It's like, okay, yep, that works for me.
Yeah, I make it work no matter what, right?
I'll make it work. Yeah, yeah. So.
You ever catch yourself thinking like a therapist while you've been going through your own recovery?
Um, yeah, I- yes, because I think the way that I the way that I'm an OT, I have a holistic approach as well. So it's not just when I'm working with my patient, okay, well, what medical equipment do you need? Do you have grab bars? Kind of that assessment. I do like to really work with the whole patient, especially on the mental health side too. So in that way, I was kind of leaning on my OT training and the way that I like to integrate mental health into my practice. So yeah, I was meditating. I was doing yoga when I could, when I had the energy. My wife and I go to the gym on Saturdays, and I kept with that routine.
Mhm.
Um, and it was quite humbling because, kind of going back to your question, knowing too much, like does it help or hurt you? Being an OT, every week working with you, when I first went in and I got my baseline of where I was, I'm like, okay, I'm doing really good. every week just to see the steady decline of
Mhm.
like, whew, oh my gosh, like I could, do 15 pounds and now I'm struggling with six. I mean, it was humbling. It was
Yeah.
really humbling to witness my body go through that
Mhm.
change.
But I think one thing that I really applaud in you is you didn't know let that beat you up. So you can go in two directions, right? You can either say, I'm just gonna let my body do what it feels like, and I can guarantee you that at that point your body only wanted to sit down and do
Yeah,
nothing else.
yeah,
Versus you always thought if I let my body do what my body wants to do, this is gonna go downhill and I'm not gonna like myself afterward. So let's just push through whatever I can. And if I need to kind of dial down a little bit, I used to push myself. It's okay,
mhm,
but we're gonna push. So
mhm,
sometimes I was actually I was talking with my students about this podcast today, and I was like very excited about this, and I was actually telling them you're gonna meet them tomorrow, but I was talk we were talking about doing our chat review for tomorrow, and I was like, look, she's amazing. I push her because I know I did, and I know someday she wanted to hit me and hate me, but I'm like, we're gonna do this because I know it's gonna only be good for you, right? So it's nice
yeah,
to be able to have that coaching and that support and then understanding that at any point I want to hurt you. And of course, if I tell you to do this and you cannot do it, it's okay to say, I can. I need to back off. And it's okay for me
yeah,
to say, fine, we're going to back off and wait, but we're going to continue doing our hit and we're going to continue doing 30 seconds. And you're just going to
yeah,
breathe and take a little breather and take some water, and vitals are good. You're not going to pass out on me. I'm okay. We're just going to get going, right? And
yeah.
then that make you feel only better afterward every single time.
Yeah, because you were the one who told me, which again, like, what did I know about cancer? Nothing. I had no idea that those hit workouts prior to going into my chemo treatments, my infusions, would help with the medication. It made the chemo more effective, and so when I heard that, I'm like, okay. I mean, I already knew that I was gonna not just sit on the couch and take this. I want it to move. I didn't want to have such a major disruption in my life, even though it was a disruption. But working out, moving my body, doing yoga, anything that gets me back into myself. And so I wanted to feel strong in any way that I could. So when you told me that doing those HIIT exercises would help with the chemo, I'm like, okay, all
Let's do
right, I want to be the best cancer patient that HIIT is it is. So if I'm not doing it with you prior to the infusion, I was doing it at home or going for a walk around the block.
Perfect. Yeah.
Yeah.
Yeah. And then at this point, I wish I know you have a great response to the chemotherapy and you're doing really great outcomes so far. Um, is that due to what you did or not? We don't know, but I just really have a feeling every time I have patients like you doing how you did it and how well you did it through the whole thing with your fasting, your meditation, your yoga, your exercise program, your eating habits, sleeping, like self-care, all of you guys have really great outcomes. So this is just, I don't know if it's casualty or not, but we know works. So in
I
every single
wish
time.
I know I wish I could have cloned myself. Like this is just me, I don't know, doing eating whatever. I mean, it's amazing when I ask, professionals, well, what's a good what can I eat? What can I do? Well, you're going through a hard time. You can eat whatever. No, this is when you should double down on like your health. Like stay hydrated. I bought those little hydration packets that was in my water every single day. I
Mhm.
was getting hydrated. I had protein shakes. I was eating eggs every day. I did the 18 to 19 hours of fasting before every infusion. I went into the sauna. Thankfully, we have a sauna here at our house, and so I would do that twice a week, and that's where my wife and I would go, and we would do it together, and that was our time like to talk because I mean, cancer obviously, it just doesn't affect you. It's
The whole
affects
family.
the
Yeah.
whole family. So that was kind of our therapy time
Mhm.
in there. And so it was like whatever I can throw at this that I have control over, I'm going to. And I really wish. I could know, what would it have been like if I didn't do all of those things
Yeah.
because I kept most of my hair. I mean,
Yeah. Look at
this
that.
is, well, this is growing back. It thinned out, but it didn't completely fall out.
Mhm.
I
And you didn't even use cold caps, right?
I didn't use cold caps. I only used, like at your suggestion, froze water bottles and I held on to those to help with the peripheral neuropathy. And then I had those ice boots. So I
Mhm.
put those on at every infusion religiously. I hated it, but I didn't have any peripheral neuropathy. So,
Awesome. So I'm going to ask you a couple of questions that you mentioned that I think will be really helpful for the audience out there. In the beginning, you mentioned about breath work, the 478. Will you explain that to the audience what that means and what does that to your body?
yep. So the 478 breath, it it helps to activate the parasympathetic nervous system. So that's your, rest and digest. Sympathetic is your fight or flight. So the principle around that is you take a breath, a deep breath for 4 seconds, then you hold it at the top of your breath for a count of 7, and then you exhale for 8. And then you do several cycles of that, and that really does help to regulate the nervous system, regulate your heart rate, your breathing. It kind of de-escalates any tension or stress that you carry, and it really works for me. And I taught it to my girls too, and my patients. So that's kind of the basics of the 4-7-8 breath.
Excellent. And will you talk us a little bit about the neuropathy? You say, why cold? I'm sure that some of people in the audience will be like, oh, how is this work with the the water bottles and cold boots and the feet? And what is this neuropathy means?
Yeah, and from my understanding, and please jump in if I'm misunderstood here, um, that the chemo, I mean, it's systemic, so it goes everywhere, and the purpose of the ice booties and the ice packs in the hands, it's acts as a vasoconstrictor. So it doesn't allow the chemo. In my case, it was Taxol, Paclitaxel. So it didn't allow that to kind of infiltrate those smaller vessels in my peripheral uh, fingers and toes. So, and I'm curious because I have Raynaud's also, and I'm wondering if that contributed as well because I already have restricted blood flow to my
Oh, you,
yeah.
you do okay with the cold bottles and Raynaud's because I know that's something that trigger a lot of it, isn't it?
Uh-huh. I hated it.
Oh,
I mean,
wow. I didn't even realize that. Oh, wow.
yeah. I mean, it was torture because as you know, the infusion room, like in the hospital, it's so cold.
Yeah.
And you had like my hair, I was just so cold and you can't get warm. I had the blankets on me and you're holding on to it to your extremities.
Uh,
So
Bless your heart. I have no idea you have Raynaud's.
yeah.
And oh my God. Yeah. I was gonna say usually that flare up and it's less, so wow. Yeah.
Yeah, it was a double whammy.
Yes, I um were there moments when being a healthcare professional made things harder emotionally?
Um, n n no, I was emotionally wrecked, just in general. I think n not working as a healthcare provider was difficult. I mean, I'm so grateful that I wasn't physically at the hospital working, but with that, you lose the sense of like your normalcy, your routine. Like, so my world had just shattered, and now was not working. I wasn't earning an income.
Mhm.
So it just emotionally took a toll. So. Yeah, I tried to fill my days in the morning. I would have my tea and read a book that a friend gave me by Pema Chodron, When Things Fall Apart.
Nice.
And every morning I would read a little chapter of that just to, I don't know, get my emotional state right because I didn't have an identity anymore. I wasn't just an OT and
Mhm.
a mom and a wife. It was like I was a cancer patient,
Yeah,
and was cancer takes up a lot of space,
yeah, yeah.
and there's not room for much else. And so that was overwhelming, really having to change my identity. And even now, trying to switch off from, active cancer treatment and where I'm at to like, okay, I'm coming out of the fog. I'm on the other end. I'm 2.5 weeks post surgery.
Mhm.
Who am I now?
Mhm.
And I'm not that same person. And I don't want to be that same person. I have learned so much, and I feel like cancer kind of chiseled away a lot of the things that I don't know were insignificant. And
Yep,
I had
totally.
a meeting the other day, where it could have been like a 3 bell alarm. I just kept my cool, and I'm like, you know what? It's not cancer.
I'm sure people was like, "What? Who is talking now?" Yeah,
I mean, I really felt like there was a calm that I think my pre-cancer self would have been like, oh my God,
in the
okay,
world.
all right, all hands on deck. We got to figure out this problem. Is like, well, it's not cancer.
Yeah. It's amazing how a situation like this just really put things on perspective totally different. Like, was a book called like, Don't Sweat the Small Stuff.
It's all small stuff.
Yeah, yeah. And then it's like really like this is one thing I've been learning through all these years. Again, I have not been on your shoes, but just working with you guys daily make me that way. Like it's no big deal. Like, why do I complain about having a little neck pain? Or why, my family again, same situation, somebody says something like, come on, this is just a small thing, it can get fixed, right? It's certain things you kind of fix and really change and shape your life so much differently.
Mhm.
So definitely make you learn a lot. Like if I've been learning from every one of you every time, I just cannot imagine where you guys are so much different afterward because really you just learn your body differently and only become healthier. That's usually what happens.
Yeah, and it's interesting, and I don't want to get too much off on a tangent, but for my particular situation and my body, like I was just getting my groove because I had a hysterectomy a year ago, a year and a day to my mastectomy. So it was
Wow.
I had the hysterectomy. I was put on hormones, and I was feeling great. I was feeling so great. So when I got my diagnosis on July 31st, my doctor was like, "You have cancer and stop all of your hormones forever." And so, like, I didn't know what hit me harder, like
And
the cancer diagnosis
the hormone.
or the hormones, because I'm now getting to know my body in this different way that like, my hips feel like an 80-year-old's hips. I feel like I have arthritis and like my elbows and things that, I know the chemo did damage, but also my low estrogen, all testosterone, all of it. It just wreaked havoc. So,
Yeah. And I want you to, and I think we have this conversation a little bit before, and I didn't want to go in extend on it at
mhm,
the time because it's like, you know what, this is not time for this. Let's just focus on your neoadjuvant chemo. Let's focus now on your surgery recovering and let's kind of get you over the other side where you can get your function back. We were just talking about how you feel like right now you're a T-Rex, cannot use your arms much. So hopefully we get you going towards be able to get back to function and
mhm,
then kind of get all that level out. And then we're going to start having a conversation of like, estrogen, how estrogen matters. It is a book called Estrogen Matters, which is a great book that I keep hearing from any other podcaster, host recommending. And I'm totally agree. I think that every breast cancer patient should read this book because it's super important. But will be a time where we have the conversation of, okay, how can I get my body not to feel like an 80-year-old body? Because we
mhm.
want that, right? We talk about being healthier after cancer, but not necessarily diminish the quality of life because these hormone blockers or stop
Mhm.
hormones and so forth. So again,
Mhm.
another conversation that for sure we'll talk about a lot after work. And like, unfortunately, this is this is now is great times because this conversation is happening out there a lot with
Mhm.
menopause society and really a lot of power in regarding no, hormones are not as bad as we're thinking. And
Mhm.
perhaps, what else can we do for patients? Because
Mhm.
again, yeah, you're now a breast cancer survivor, but you're miserable because everything goes downhill. So is that really a good thing? So
Right.
again, it's a lot more pooling now and hopefully education for, a lot of the other providers, medical oncology surgeons and
Mhm.
so forth in this aspect that we kind of really looking into improving in the survivorship part because now, yeah, you're a survivor, but what kind of survivor you want to be, right?
Right, right. I bought that book by Danny
Yes.
Bennington, and I know she was a guest of yours, and menopause after cancer.
Yep.
So
Yep.
to go back to the advocacy part, I'm writing a bunch of questions to give to my oncologist ahead of our meeting in March to say this is what I want to discuss so that we make our meeting the most productive and kind of focus. Like these are the things that I want to talk about. So just
Absolutely.
advocating.
Exactly. And again, you may just have to bring that education and they may be like, I don't think I'm agree with, and you're like totally okay, but then who else can I go? I
Exactly.
disagree with this. But what I really, the message that I say day to day to every patient is like, don't just go by because your provider is not agree with it. That doesn't mean this is it for you. Because
Mhm.
at the end of the day, again, it's your body. So let's find out who else can listen to your concerns and what
Mhm.
else can you go and consult, and they may have a different opinion. So yeah.
Exactly.
So that's
Exactly.
kind of the good thing now that there's so many people on the podcast and social media and all this, you really can get a lot of information and really good information for like, physicians and good providers. It's not
Mhm.
like anybody who doesn't know what they're talking about.
Right, right. And we are well equipped now to join the conversation and be active participants. And it's not just in this patriarchal kind of setup where it's, the doctor saying, well, you need to do this. It's like, well, no, according to my research, I'd like to discuss these options. So, yeah, I'm looking forward to the conversation, not just, a
Exactly.
one-way street here.
Exactly. But unfortunately, you're still having some physicians who like to be one-way street. And what I want to tell patients and the audience out there, even if you're like a relative from somebody who is going through cancer, is not it. This is not it. You can be like, just because your doctors say no, doesn't mean other providers are gonna say the same way. And you cannot be agree and you'll never be agree, and that's okay. I just need to find somebody else who has a different view and look things in a different way, or at least is willing to hear. But if you all ever come across to a physician that says, no, it has to be my way or my way, you better find somebody else.
That's right.
That's not good for you anyway. So,
Yes. Claro que sí.
um, what were the most challenging everyday activities for you during treatment or recovery?
Oh God. Every week there was something new. It was always, I was like, what's it going to be this week? First week diarrhea, second week constipation, third week mouth sores. It was something. As a female and also like postmenopausal, in addition to, the heavy chemo drugs, I wasn't prepared for the dryness, the like my eyes were super dry. My nose was dry. It was bloody every day because I didn't have nose hairs. And who expect, you don't think. So I always carried around a tissue. My mouth was always dry. So I bought the Biotene and used that toothpaste and the mouthwash because my mouth was so sensitive. I couldn't have even little white pepper. It was so like spicy. My toothpaste was spicy, like just the vaginal issues, just being the vaginal dryness and the atrophy. It's like these things no one tells you about. You're like, oh my gosh. So I had my first UTI since high school, and high
Wow.
school was 30 years ago.
Wow. Hmm.
And so I wasn't prepared for those issues, tearing, having, a bowel movement because everything is dry. The brain fog, so that was like a 1-2 punch with the chemo and also, postmenopausal symptoms. So trying to like have a conversation and use my words was just
Yeah.
struggling. So, fatigue and where I struggled was in the past, I equated, laying on the couch and resting with laziness. And
Mhm.
I wanted to participate in my household and like picking up the girls and, you know, d- folding laundry. And some days I just couldn't.
Mhm.
So just participating in life could be really overwhelming. That's kind of where I was having a lot of difficulty.
And which OT principles or strategies made you the biggest difference in your own healing? So when you were having these situations, what did you do to cope with the frustration of not be able to do it?
Um, I started to see a therapist, so I think just going into I don't know where the lines kind of blur between OT, like where that leaves off, and where just my normal kind of MO of doing life as a healthy and mind, body, and spirit kind of person, where those lines blur. But I started seeing a therapist
Okay, good.
um, and a therapist that specializes in with oncology patients. So that really helped to talk and have moments with my wife where we could really connect.
Mhm.
And you know, I I would have strong days and she would fall apart, and then she would have strong days and I would fall apart. So
Mhm.
really trying to be in that dance
Mhm.
with her. And you said what other strategies
Yeah,
or what was
that was one of them, and I think it's super important. Again, we can think, and you already come from a background to be holistic and mental health and strategies to help with that, which is great, but many people does not,
yeah,
right? Like I have a hard meditating, like my mind just goes everywhere when I meditate. Like I can't, but I
yeah,
can do breath work and I can exercise is my way of coping. This is like, I feel good or bad. That's kind of, I love to do that. And that's my way of stress management and everything else, right?
mm,
So I think is important on that mental health part. And I think sometimes it's great to have a therapist that you can actually talk to because even though there's times you have a great relationship with your wife or any relative, but it is not the same, right? It's certain things that you just have to tell somebody else who knows in how to manage that because they're the experts, right? So they can give you strategies in how to not only listening, but how to work with how you're feeling at that point or how to improve whatever is going on through your life, mind, and relationship that can help to improve
yeah,
while you go into hard times.
yeah. And I've got a really great network of friends, a very strong community. So once a month, I meet with a group of women and where we just kind of share our struggles and our triumphs. And so that I really leaned on heavily as a support because it really does take a village to
Yeah.
get through this. And then I have another group where we do like a choir practice, so we sing. And
Oh, that's nice. That's nice.
yeah, so that really helped. But going back to your question about OT strategies, I think I've leaned on that more in this post-surgery part
Yeah.
where I'm like, okay, I need a shower chair. I I need to
Richard.
yes, I need these I know how to get into my clothes without, going past my precautions. Like I'm using those strategies more effectively like post-surgery.
Yeah. Yeah.
So that's kind of where I've integrated my OT skills.
Yeah. Yeah. Well, but look at that, right? I didn't know that OT, occupational therapists, did anything about mental health at all until I met Tony here, who is our guy who does a lot of the mental health. Like I have no idea you guys have that under your sleeve, right? At all. Until then, and it's amazing. Like, in the beginning when we start the program here with Tony, and he was like, I need to start seeing your patients. Like, well, I don't know. I think it's a great idea, but I think we're going to start doing it post-op because, patients are so overwhelming the first time we meet them prior to whatever, either chemo or surgery is going to happen. I think we're just gonna overwhelm them. And let me just do it after surgery. And he's like, well, actually, I think that they may just do really well before because it's stressful just the diagnosis. And I'm like, but they may be okay. Let's give it a try and see what happened. Oh my God, everybody super helpful, appreciate that, really has been amazing. And then it's like it's not just breast cancer, it's any cancer diagnosed, right? So or anything you struggle with. They have a great group for long COVID, and they have things for chronic pain management. And so it's a lot of things that really mental health is huge. And I did not realize how big it is in everything we do every day. Like you say, just you go into that high stress for anything, right? You're driving and somebody just cut you, and then your stress levels go up, and you just do some breath work, and that just kind of like help you to calm down. Like, those little things that you can just use, not just when you face a
Yeah.
disease, but as well any stressful moments,
Yeah.
that's happening. So, um, what activities help you to feel most like yourself again?
Um, well, cocktails and bananagrams. And let me expand on that. Okay. I am very healthy, right? And I enjoy a cocktail from time to time. And in the beginning, I had heard from a lot of like patients like, oh,
No
you're gonna need to
alcohol.
no alcohol, no sugar, da, 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 no, no, no. I was hearing no so much. I'm like, but
What
what?
is fun in life, right?
Yeah, I'm like, this is no fun. I like to me, like I needed that time with my wife to have our cocktail and our bananagrams sitting on the floor with our cat next to the fireplace and our time to connect. So we didn't do that all the time, but I needed to know that that was there and that I had permission to do that. So I gave myself permission to do that. So that kind of that made me feel like I was back to myself.
Okay.
Um, yeah. Going to the gym, like I mentioned,
Size was a key. Yep.
yeah, hanging out with my friends. When I didn't feel like and didn't have the energy to go out, yoga with Adrienne. If your listeners have never heard of yoga with Adrienne, please look her up on
Hey,
YouTube.
yeah, I've been doing it. It's great.
Oh my gosh, she felt like a friend. She feels like a hug,
Mhm.
and you can choose whichever type of yeah, however you're feeling. So I
Just for
just
free. Doesn't cost you anything.
for
Yeah.
free, for free, totally,
Yep. Yep.
totally. So yeah, so that's that's what I did.
And then what message of hope do you want listeners, especially fellow clinicians and survivors, to walk away with to wrap up?
Okay. I thought I would what I would do is share an email I just wrote. My friend's niece was just diagnosed with breast cancer a couple of weeks ago, and she had asked to meet me and if I could like give her some tips. So I compiled this email that I'm happy to pass on to any of
Yeah, and
your
I'd be happy to put it on the show notes.
yeah, so this is where I linked to all of the things. So I'll just read you what I opened up with.
Okay.
I said, welcome to this shittiest club you never wanted to be a part of. I was diagnosed with triple positive breast cancer on July 31st. From that time, and still now, I've been surrounded by survivors wanting to help and support. For the shittiest club, it sure does have the best welcoming committee. I'm not going to lie, it's going to be rough. Here are some things that I bought that helped make it tolerable. You are in the scariest part, the beginning. Try not to zoom out and look all the way down the road. Every time I did, it always wrecked me. One day at a time, find your people, surround yourself with love and positivity. Cry when you need to. Listen to your body, advocate for yourself. My wife made a spreadsheet of my chemo schedule and sent it to our friends, who then signed up to take me to my infusions. It takes a village. I said, feel free to text or call me. I gave my number. I wish you strength and resilience. I said, this too shall pass. Some days like a kidney stone, but it'll pass.
I love it. That's awesome. I so love it. I'm gonna use that with your permission to give to patients if you don't mind. I love it. I think
Take it.
absolutely. So Lisa, has been a pleasure. We're gonna do part two. We're gonna do part two in a few months when you're recovering out of where you are and back into, like I know you're working in a business, which I would love to tell the audience about it. So we're just gonna get part two when you're recovering out of this post-surgical and kind of get things balanced out in a few months and get you going. I'd love to have you back.
I would love that, Durley. Thank you so much.
Thank you for being part of the show.
Oh, thank you.
Oh, where can people contact you? And I will put that on the show notes as well.
Oh, okay. Well, they can go to my website if they want to check out my photography work at alangfordphoto.com, or my email, yoadrienne22 at gmail.com. So yoadrienne22 at gmail.com.
Great. And like I said before, I'll put that on the show notes so people can have access to it. So thank you again, and I'll see you later.
Okay, thank you, Durley.
Take care. Bye.
Bye.